are Team 38. We are going to present our final project, a generative diffusion framework for cuffless blood pressure monitoring. We aim to combine the comfort of wearable sensors with the clinical accuracy of hospital equipment. Continuous blood pressure, or BP, monitoring is vital for hypertension management, while photoplethysmography, or PPG, sensors in smartwatches are convenient. But they lack the accuracy of clinical electrocardiography, or ECGs, in predicting blood pressures. Existing methods try to map PPG directly to BP or generate ECG using GANs, but they often fail to preserve crucial details like R-peak alignment. Our goal is to fix this using a diffusion model approach. We use around 2,000 hours of ICU waveform data from MIMIC-3 dataset, where PPG, ECG, and invasive atrial blood pressure, or BP, are recorded simultaneously. This is only a subset of the full database because of limited computational resources. When we compute pairwise correlations, PPG and ABP has the largest magnitude at about minus 0.0225, which correlations involving ECG are almost zero. So this suggests that simply linear mappings are not sufficient, and we need to consider PPG and ECG for ABP prediction. Here is our overall pipeline. We treat this as a two-stage model. In stage 1, we use a conditional diffusion model to translate the optical PPG signal into a synthetic electronical ECG signal. And then in stage 2, we fuse this generated ECG with the original PPG data. We fed both into a by LSTM network, which analyzes the temporal dependencies to estimate systolic and diastolic blood pressure, or SBP, DBP. So why we use diffusion model? Unlike GANs, which can suffer from model collapses, diffusion model iteratively refine noise into structures. Our implementation specifically targets the R-peak alignment issue found in previous work. By incorporating adaptive search and scale alignment during generation, we ensure the synthetic ECG isn't just a generic heartbeat, but is temporarily aligned with the input PPG. We have rigorously evaluated baseline models on the MIMIC-3 dataset. As shown here, a simple linear regression failed with an error over 20. Our LSTM baseline improved this significantly to 9.5, but this still falls short of the BHS grade A standard of the blood pressure monitoring of 5 mg mmHg. This cap confirms that directly sequence modeling isn't enough. We need the morphological features provided by our generative stage. Beyond our current diffusion, plus by LSTM pipeline, we are actively exploring advanced architectures. We plan to replace the LSTM with transformer-based models, like patch TST, to better capture long-range dependencies. We are also investigating cross-model attention mechanisms to dynamically weight the importance of the real PPG versus our generative ECG. In summary, our project aims to bridge the gap between wearable convenience and clinical accuracy. By leveraging diffusion models to recover high-fidelity ECG signals, we provide the necessary physiological content for reliable blood pressure estimation. We are on track to finalize our framework and aim for grade A performance. Thank you. Here are the references. Thanks you for watching.